So like we were talking, art therapy ma what is the age range? Like 18 भन्दा above को student हरु अथवा youth हरु त आइराको हुनुहुन्छ नै हैन तर maximum कति age सम्मको student हरु अथवा कति age सम्मको people हरु are having faith in art therapy, and who are the people who are coming in order to experience what it feels like?
So मका आउने age group is 5 years plus. Of course children भनेपछि बच्चा पेरेन्ट्सहरुले लिएर आउनुहुन्छ मेरो बच्चामा यताउति इस्यु भयो भनेर youth भन्दा पनि yes कलेज स्टुडेन्ट्स युनिभर्सिटी स्टुडेन्ट्सहरु आउनुहुन्छ भने प्रोफेसनल्सहरु पनि उति नै आउनुहुन्छ
ओके
प्रोफेसनल्स जसले चाहिँ आफ्नो प्रोफेसनल लाइफ र पर्सनल लाइफमा एउटा सेग्रिगेसन गर्न सक्नुहुन्न द स्ट्रेस अफ वर्क हैन र सिनियर सिटिजन्सहरु पनि आउनुहुन्छ किन भन्दाखेरि चाहिँ अहिलेको दिनमा हेर्यो भने the youth are mostly away from the country. पढ्नलाई भनेर जानुहुन्छ त्यसपछि a lot of people stay away. So who are left in the country भन्यो भने is the older people. So older people भन्दैमा सधैँ दुई जना हुँदैन, right? Sometimes it's the man, sometimes it's the woman. So who do they talk to? So कुरा गर्ने मान्छे नहुने बित्तिकै एक किसिमको लोनलीनेस आउँछ. So त्यसले गर्दाखेरि I think हरेक एज ग्रुप र youth आउनुहुन्छ. The good thing is the youth are more open to art therapy. The children are brought by force by parents. Ani senior people because when they see that they are probably lonely or they are maybe going to go through depression, then somebody or the other from the family bring them.
Okay, so have you seen a profound increase in the number of older people? We're talking about older people, and increase in the number of suicide cases of older people पनि आएको छ. पहिला यस्तो हुँदैन थियो हैन. When we were talking पहिला युथहरुमा suicide cases हाई देखिन्थ्यो अथवा people were suffering from midlife crisis त्यो एज ग्यापमा हाई देखिन्थ्यो तर अहिले older people also they are tending towards taking their life हैन. So त्यो कारणले गर्दाखेरि पनि do you think therapy ma aune people, do they seek advices in such a situation where they are at the verge of ending life, or do they just come generally to experience how it is vanera?
No, the people who come to me come with issues.
Okay.
When a person approaches me, it's always about, okay, I'm having a hard time dealing with something, right? For some people, it's something that they feel they're starting to have problems with, but there are others who feel like, okay, they want to give up. To also answer your question, I see a lot of issues with self-harm. Unfortunately, it's almost something that's trending. You know, every other child who comes to me, aged between 12 and 16, is thinking of self-harm or has friends who are doing it, at home or in school. Yes, in older cases, there are also people who are frustrated. They don't have anybody to talk to. There's an element of loneliness, and that leads them to think about ending their life. So, yes, I mean, if somebody comes to me and says, okay, I'm suicidal, then of course it's a red flag, and I need to reach out to family members and other people to get them help, because that's definite red flag, right? But generally the people who come to me come saying that, okay, I think I'm frustrated. I think I'm lonely. I don't have anybody to talk to. And my job is to help them see a newer perspective, So, yeah.
So where does the generation of today stand at the point of view of applying art therapy as a source of counseling themselves?
A lot. I am happily surprised that the youth are now reaching out for help. 90% of my appointments are given to younger people who go to colleges and universities, younger professionals who reach out for help saying, can I have an appointment? They're mostly from like 18 to about 24. And they're very open to the idea of coming for therapy. A lot of people come because they've been given my reference to somebody who's already been here, but other people, they do their research. They Google, so they find out what they're wanting, and they see art therapy as a very reliable source which could help them, because art therapy is in fact evidence-based work. So we're not just doing talk therapy, but we are actually creating visuals which helps them.
So I mean, art therapy iti bhanam, but we have not exactly talked about what is art therapy, because फर्स्टमा यो सेसन गर्नुभन्दा अगाडि इभन आई डिड नट हेभ एन आइडिया समथिङ लाइक द्याट एक्जिस्टेड इन नेपालमा भनेर सो देयर इज सिग्निफिकेन्ट अमाउन्ट अफ युथहरू हुनुहुन्छ हाम्रो जसलाई चाहिँ आइडिया छैन वाट एक्ज्याक्टली आर्ट थेरापी इज भनेर अहिलेसम्म पनि सो वाइ डोन्ट यु एक्सप्लेन अस एक्ज्याक्टली वाट आर्ट थेरापी इज
ओके सो इफ वी आर गोइङ टु ब्रेक डाउन आर्ट थेरापी देयर इज एन एलिमेन्ट अफ आर्ट which is a visual medium. अब आर्ट भनेपछि एनिथिङ द्याट यु मेक सानै बेलादेखि ड्रइङ गर्नुभयो होला यु नो भिडियोज हेर्नुभयो होला एनिथिङ द्याट इज भिजुअल representation would be termed as art, right? Therapy is when you go to seek help where you're talking to somebody. You know, you're trying to find some clarity. त्यो गाँठो परेको खोल्ने जस्तै हो कि थेरापी भनेको. अब आर्ट थेरापीलाई हामीले सँगै राख्यौँ भने के भन्छ भने कतिचोटि हामीलाई भएको इस्युजहरू हामीले कुरा गर्न सक्दैनौँ, कतिचोटि हामीलाई थाहा पनि हुँदैन कि हामीलाई के भइरहेछ होइन. बिहान उठेको बेलामा कहिलेकाहीँ दिक्क लाग्छ, कहिलेकाहीँ रिस उठ्छ, कहिलेकाहीँ हेत्तिरिका कति छिटो बिहान भयो भने जस्तो हुन्छ होइन. कहिलेकाहीँ रुन मन लागिरहेको हुन्छ तर यसो सोच्यो भने किन भइरहेछ मलाई त्यो थाहा नै हुँदैन है. सो आर्ट थेरापी भनेको चाहिँ के हो भने तपाईँलाई के फिल भइरहेछ त्यसको हामीले भिजुअल रिप्रेजेन्टेसन बनाउँछौँ. कतिचोटि जब कुनै पनि हाउ आर यु भन्दा वेल आई डोन्ट नो हाउ आई एम भन्ने आन्सर आउँछ, त्यही कुरा तपाईँले ड्रइङ गर्ने हो त लाइक भन्यो भने यु नो देयर इज अ भिजुअल रिप्रेजेन्टेसन. कोरेर हुन्छ कि हुन्छ नि पेन्सिलले भाँच्ने गरेर थिचेर हुन्छ कि तर देयर इज अ भिजुअल रिप्रेजेन्टेसन कि दिस इज हाउ आई फिल होइन. सो आर्ट थेरापीले चाहिँ के गर्छ भने तपाईँको जुन मनमा रहेको एनी नेगेटिभ एक्सपिरियन्सेस, नेगेटिभ थट्स होइन, जुन अहिले मात्र होइन सानै बेलादेखिको एक्सपिरियन्सेसहरूबाट आएको छ, त्यसलाई चाहिँ तपाईँले पेपरमा हाल्न हेल्प गर्छ र पेपरमा हालिसकेपछि त्यसपछि त्यसको बारेमा कुरा गर्न सजिलो भयो होइन. सो इट जस्ट हेल्प्स यु अन्डरस्ट्यान्ड यर सेल्फ बेटर. आर्ट थेरापी गर्ने भनेको इट्स अ जर्नी टु डिस्कभर यर सेल्फ. इट्स एज सिम्पल एज द्याट.
सो मनको गाँठोलाई आर्टको थ्रु निकाल्यौँ भने त्यसलाई आर्ट थेरापी भनेर भन्न मिल्यो होइन.
सिम्पल वेमा भन्दाखेरि यस.
So we're talking about art therapy, so we need to introduce you, of course, before we start the podcast. So today with us we have Miss Lajja Dixit. She is a clinical art therapist who's been doing profound work in the field of art, in the field of counseling, and she's also worked with INGOs, NGOs, and she's been doing incredible work in her field. So welcome to the podcast.
Thank you.
Yeah?
Thank you. Yeah.
Okay. So we're talking about रिलेसनसिपको डाइनामिक्सहरू चाहिँ के छ र त्यसमा चाहिँ युथको मेन्टल हेल्थको अहिले स्टेट कस्तो सिचुएसनमा पुगेको छ भन्ने कुरा we're talking today.
Okay.
So when you're dealing with your patients, when you're dealing with your clients, so is it only some sort of relationship, like relationship भन्ने बित्तिकै अहिले what we actually think about is a girl and a boy or a boy and a boy, a couple भनौँ न होइन. तर the people who are actually seeking counseling, do they have the dynamics of different sort of like mother, father, brothers, unclesहरूसँग इस्यु भएको खाले इस्युजहरू पनि आउँछ कि is it only limited to a couple?
Okay, so to answer your question, first I want to hint at something, which is the people who come to me are my clients because I'm not a doctor. I'm just a therapist. So therefore, we will refer to them as clients and not patients. So yes, when people come to me, it is, remember what I said. In therapy, we work with memories. Okay? So the adults we have become, whether we are 18 or whether we are 80 years old, we are the way we are because of our experiences. Experiences from the time we are born. You know, the good, bad, and the ugly. Everything that we've been through shapes us to become who we are. Now, if you think of that trajectory, we cannot talk about relationship as just as a couple. We're talking about our relationship with our grandparents, our parents, our uncles and aunts, our siblings, you know, and our friend circle as well. So remember, with every relationship that we have dealt with, there is something good about it and there's something bad about it. And imagine carrying all of that till adulthood. And so many times when a couple goes through a problem factor in the relationship, they like to blame it on each other, right? But it's so important to look into yourself and see where you're coming from, how your upbringing was, what kind of conflict did you see. Because for a lot of youth, when they have a problem with a relationship, it is also to do with the fact that perhaps they have been a spectator of their parents who went through conflict, you know, who went through a lot of aggression, and they somehow do get affected by it.
Yeah.
So unconsciously, they might make up their mind that, okay, this is not what I want. So this is probably not the kind of person I would want to be, right? Now, what that does is, when they finally do meet somebody, they're constantly comparing that person with a family member who they've seen having conflict. That's why when we talk about relationships, I think we need to address, which I do in therapy, our relationship through the years, the different relationships, because that is the dynamic that we have brought to the table when we are in a relationship ourselves.
So we're talking about, you know, how hamro, whatever we see in the child is going to affect us in the long run.
Yes.
Whether it is with your as a couple pani or a personality altogether.
Yeah.
I read somewhere ki if you want to set a good example for your children in order to foster afterwards, you have to be a loving couple in front of them. You have to
Right.
show mutual understanding between each other so that the child learns. Bhanera. So do you think most of the reasons why people are affected so much આજકાલ and they have unstable mental health, do you think all of that is the emotional baggage that they've seen from the childhood? Is it all the effect of it, or do you think it is a gradual effect of whatever they've been facing in their life personally?
I think it's both. Because in my experience, right, when I see a child who has been a spectator of some conflict, you know, not just between their parents, but especially in a joint family, between the other members of a family, right? They do get very aggressive sometimes. Sometimes their self-esteem goes down. They are really affected by what is happening. So now that does, you know, somehow shape their personality. You know, some people pick up on that aggression because a child thinks that it's okay to be aggressive. Why? Because an adult at home is doing it.
Yeah.
Remember how we look up to the adults, right? So anything somebody older than us does it is okay. And therefore, a child might be aggressive at school. A child might be aggressive with their siblings. And they don't think it's wrong because they've seen it happen, right? Now, in so many cases, a child who's maybe about 16 or 17 who has seen their parents in conflict do tell me that, why are my parents living together if they're fighting so much?
Yeah.
You know, I would prefer to have parents, happier parents, live separately rather than live together and create so much noise at home, right? So I think through this platform, I would also like to address that so many times parents feel that no matter how much, you know, they are not getting along, and they like to put up this pretense that everything is okay in front of their child, they need to understand that this generation is very smart.
Yeah.
You know, you cannot expect the child not to know. Whether you're fighting behind doors or you're trying to create this, you know, almost like a Dundan ko happy family sort of persona you're giving to the child picks up on negatives. And that does not do the child any good. Therefore, if they think that they are having a difficult time handling their marriage, they should seek help. They should probably go for counseling. They should do this and that. But they should not live under the illusion that they are protecting their child by, you know, hiding their conflict. So that is something that's really important.
Agi, we talked about self-harm, right?
Yeah.
So we talked about how unfortunately it's a trend.
Yeah.
Personally, when I was in school also, there was a trend ki sharpener ko blade nikalera, you used to make marks on your wrist. Right? And the higher the number of marks, the cooler you were. Because even if you don't have any issue, the other person is doing, so I'll do it because she's getting attention. So for the sake of attention also, there was a lot of these things that were happening.
Wow.
So why is it so unfortunate that youth of today, they are so much attracted, or they are thinking ki self-harm is one of the way in order to solve their mental anxiety or in order to express themselves? Bhanera chai self-harm यति धेरै popular हुनुको reason चाहिँ के होला?
I mean, I think just like you said,
So
the higher the
attention.
marks, you know, you're probably getting a lot more attention. That's one element, right? Another element in much more serious cases is there are children who are unable to talk about their feelings. You know, they're probably in an environment at home where maybe the parents are really busy, or they're not getting the kind of attention they need, right? Or they're being told off when they say they need help, because that happens a lot. So what they do is they think inflicting pain on themselves helps them, because they think that physical pain is equal to them helping themselves, which is a very wrong way of looking at things. But then who is going to tell them? You know, because they do such things in hiding. Nobody at home will go in front of the parents and cut themselves, right?
No.
They do it in hiding in the bathroom or in school, in the school bathroom. So they do that sometimes, yes, to seek attention, because that's their way of crying out for help. And the people around them need to see it and address it and get them the support that they need. Other times, yes, it is peer pressure. You know,
It's very unfortunate to think that self-harm is something that's instincted, that's something inflicted by peer pressure, because
it is.
it has a lot of pain, and it leaves a lot of scars.
Of course. And then we need to explain to the younger generation that yes, you might think it's cool and trending right now, but unfortunately the marks that you have will stay for life, and there will come a point when you're going to look back and say, oh my God, what did I do? And that comes with a lot of regret and guilt. And I'm talking about the kind of self-harm which happens because it is due to peer pressure, because you think, it's a good thing to do because everybody else is doing it. I'm not talking about issues of self-harm in serious cases of mental health. That is somewhere where people are seeking help. That is very different. We cannot address it together. So self-harm because your friends are doing it and you think that's something you should do and it's trending is something else. But there are people who struggle within the family. There are people who don't get the access to have a conversation, talk about how they feel, and they feel lonely. And they think the only way to address their loneliness is through pain. So those are two very different things.
So I knew somebody who is my age, who was studying with me, but apparently she had to drop out of college because she couldn't take everything anymore.
Yeah.
So what happened is, usko case ma chahi she was very much into self-harm. She had scars all over her right hand and her left hand, even till the arms.
Wow.
But then that was one of the reasons she was trying to express herself, because she had no other medium in which she could actually go and talk to her parents, because according to her they were very strict and she did not think they are going to understand it. Right. So I saw something very strange Teti Belama chahi, when she was suicidal. So when she was asked to come with a guardian, she took her boyfriend along for the counseling.
Okay.
And the boyfriend was the reason she was getting triggered so much.
Right.
So it was the relationship issue that was triggering her so much. So instead of the counselor telling her that she needs to have a guardian with whom she needs to come, because of course it's her or his responsibility in order to inform them. What he did is he counseled her with the boyfriend who is triggering her. So it affected her so much she had to be admitted in a mental hospital. Okay. So this kind of let's say there's lack of professionalism in aileko counselors, or they don't understand the type of counseling that we're getting in Nepal is not encouraging us to go and take counseling. Okay? Me personally, sometimes if I feel low and I feel like maybe I should go for therapy, looking at my friends who are taking therapy or looking at the people around me, I don't feel like taking the therapy, because I don't see this level of professionalism or the level of affection that I should be receiving. So do you think it is very we have come to such a state, counseling or therapy ko kurama chai, be it in relationships or be it in any other situations, that we do not have the faith in the kind of therapy we are receiving in Nepal anymore?
Right. No, I've heard that a lot, and it's very unfortunate. I have heard from my clients who have been to other therapists where I am told that you go for therapy and the therapist gives you a self-help book saying read it, or the therapist thinks that it's okay to have the children in the same space as your client because the children are on school holiday. And you're expected to talk about your problems in front of young children. I am also told of, unfortunately, counselors who talk about their own life as a reference point, which I'm sorry doesn't really help, right? Because the idea is when you are going through a problem, right? And when somebody seeks help, they are seeking help to find a solution. They're not seeking help to engage more with the problem, right? Now, the thing with coming for therapy and what you were saying, right, for us to be more professional, I think it's really important to address one issue, which is very important, which is the topic of confidentiality.
Mm-hmm.
When somebody comes to you with a problem, right, in mental health, first of all, it's very difficult for them to approach you because mental health, unfortunately, is still stigmatized. So for them to actually build up the courage to say, okay, I need help, I need to go and talk about my problems because I don't think I can do it myself, is a huge thing. So as a professional that we are, it is our job to provide them the space where they feel safe, where they are given the assurance that it's private and everything they talk about is confidential.
Mm-hmm.
I think that is really important. Now, another thing, the thing that you talked about your friend, like I was telling you before this podcast, was through my work account, when somebody reaches out to me for an appointment, one of the first questions I ask them is, how old are you? Because anybody under 18, I am not allowed to see them without a parent or a guardian. It is just not ethical, right? Anybody over 18, yes, I do see them for a consultation alone, but if I do see their issues which could create problems for them, then yes, I would need to address it with a parent or a guardian, right? Now, there are certain steps which you need to undertake before you start therapy. The first, giving them the space, giving them the privacy, the confidentiality element is really important because it's so easy to feel judged.
No.
Yeah. Like if you see in different medical practices, especially in psychiatry, there is always a waiting room full of patients waiting to see the doctor. Now, no matter how much you're struggling, it's only just natural for you to judge the other people who are in the same waiting room.
Yeah.
Because you're already thinking of what they might be going through. You know, you're already creating a persona for them. Now, that is unfair, isn't it? Because you don't want to be judged, but you are clearly judging others. So isn't that already very uncomfortable for the patient who's actually seeking for help? So, you know, these are the kind of things that we need to talk about. We need to address if we are going to give ethical practices, if we are going to be professional enough to give them, our clients and our patient, in cases of doctors, a space where they feel comfortable. You know, comfortable enough, because remember, the person coming to you is literally crying for help.
Yeah.
So yeah, I think those are very important things.
Do you think a good counseling or a good therapy is actually helping in order to foster intimacy in relationships, not just a relationship between a couple, but within the dynamics? So a good therapy can help to foster intimacy. It can help to rebuild the relationship to some extent. So do you think it works as a band-aid in order to sustain something that has been falling apart?
Of course, like I said, art therapy is about discovering yourself. You know, it's a journey where you're addressing every little thing that may have happened in your life through a drawing, you know, which is a great way to express yourself. Now, when you do that, you do realize that there are pockets of experiences which may have affected you. And perhaps there are some emotions which you've really held on to, which technically is not helping you. So for you to be able to get closure to certain issues, what I would advise a client would be to reach out to people with whom they've had certain conflict and which is still bothering them. Because remember, we carry a lot of baggage, a lot of emotional baggage. And sometimes for us to help ourselves, it's really important to let go of that baggage. And we are, of course, when it comes to relationships, we are always depending on somebody else, right? Because two people make a relationship. So therefore, during therapy, you realize that there are some issues which need to be cleared in order for you to help yourself and to help the person in that relationship. So it does help you create a better dynamic with the other person because you realize it through therapy.
So while we're talking about the type of relationship dynamics that's going to be affected and how it affects, how it is actually helpful if you consult for therapy.
Yeah.
So, what are the type of issues that the youth nowadays usually come with when it comes to relationship problems?
Oh, wow. Okay, there's a long list. I think a lot of times it's when they talk about not being able to focus. Okay. Other times it's about their self esteem. A lot of issues that the youth come to me is because of family issues.
Okay.
Because remember, most of the time, whether we go to college or we're in a professional stream of work, right, we do go back home. And home is where our day starts and our day ends.
Yeah.
So a lot of times it has to do with things that happen in a home, which means, again, relationship, right? And then, of course, the youth, again, have issues with their own love relationships. The fact that the other person is probably not loyal to me, or, has cheated on me, or that, I don't feel the way I used to, and I don't know how I'm going to address it now. So a lot of things come up from there. What we need to understand is when a relationship goes wrong, whichever relationship, right, with parents or with siblings or with your partner, right? So when one relationship goes wrong, a lot of issues can come up from that relationship. It's like sano kura bhayo. Now, if you don't address it with the person, what happens is, remember, we human beings tend to overthink a lot.
Yeah.
And a lot of issues that is generated right now is because of overthinking. Because when there is conflict, that equals stress.
Yeah.
Now, when we are stressed, you need to ask yourself, why am I stressed? And the answer is always that we get stressed when we feel like we are not in control of something, right? We feel helpless. And through that helplessness, what happens is we tend to overthink that situation over and over again. We always go back to why that conflict started and what can I do about it. And when you're in a relationship, there's not just one person who can help that relationship.
Yeah.
It has to be a two-way traffic. And when the other person on the other side is not willing to put in the effort, the person who is getting affected will get more and more affected. So when a youth comes in or anybody comes in for help because of a relationship, what we need to remember is it is because of a stress factor that has happened. And the person might have been overthinking about it so much that it affects the way they are, it doesn't allow them to focus, it affects their self-esteem, it affects their behavior pattern, it affects their mood. So it just starts with a small seed, which is called stress.
So there is a difference between counseling and there's a difference between therapy. There are two different distinct terms. So when a person goes through a trauma, like a major trauma that forces them into self-harm, or that makes them suicidal, or they are experiencing something that isn't of a less gravity, it's something that's very gravitating.
Sure.
Do you think therapy is something that's going to solve it, or you need clinical attention, or you need medical help along with it?
Of course. I mean, unfortunately, what's happening in Nepal, I think it's been going on for many years, is when somebody goes through a problem, the first person that they run to is the psychiatrist.
Yeah.
Now, what we need to understand is, right, first of all, when there's an issue, if it's something that you can talk about within your family, within close friends, people you can trust, even just talking about it really helps solve issues. Talking about it makes you feel better, and sometimes the problem is resolved. Now, if that doesn't help, then you approach a counselor, a person who will help you with talk therapy, who will help you address the things that are going on, and they allow you to question yourself and find a solution. Now, if that doesn't help, then you go for therapy. Therapy is in a way where talk therapy comes later, where you use different medium to address and express how you feel. Like there is art therapy, there's music therapy, there's play therapy, there's drama therapy. There are different ways of they're expressive therapies, right? Now, if that doesn't seem to help, then of course you go to a psychologist and then you go to a psychiatrist, right? Now, it's our job as counselors and therapists that when we see a case where perhaps only therapy is not going to help, then we refer them to a doctor, a medical person where they probably need medication. And I would think that even for people who are already under medication, I also get a lot of referrals from doctors where somebody is already on medication, but they think that working with a therapist parallelly would help them heal faster. Of course, totally. I have a lot of clients who come to me who are already on medication, but we do therapy parallelly. So what that does is it helps them heal faster. Because just medication sometimes is not the answer. Taking medication is putting a chemical in your system to help you balance, right?
Are people open to taking medications for mental therapy? Because अहिले पनि नेपालमा there's a concept कि औषधि खाने बित्तिकै मानसिक रोग लाग्यो भन्ने, there's a term, so that they use a lot. So that's the reason people are not much open. Like if somebody would tell me right now, if I go and seek a therapy and they say you need medications in order to overcome something, you need to see somebody else, I don't think I will be open to the fact so fast ki okay, I should be taking medications, especially with the fact that a lot of people say ki ekchoti liyepachi lifelong it stays with you. Maybe that's the reason. Are people open to taking medications in terms of mental instability?
It's so strange you tell me this, because what I've seen in Nepal is people actually rush to a psychiatrist first, like I said earlier. Any problem ho pahila doctor ka gayihalum bhanyo. Now, of course, we have some very good psychiatrists in the country, and what their job is to help understand the patient and give them medication, because that's what they do, right? And after some months, and I've had clients who've come to me after years of taking medication, and then they feel like, oh my god, aushit ta liirahcha tara I still I'm depending on just medication, so they come for therapy. Like I said, Nepalma सोझै साइकियाट्रिस्ट का जाने चलन पहिलादेखि छ, बिकज थेरापिस्ट काउन्सलर्स भने मेबी त्यो बेलामा धेरै थिएन पनि होला कि. तर एक्चुअली गर्नुपर्ने चाहिँ के हो भने पहिला यदि हाम्रो फ्यामिलीमै आफ्नो सोसाइटीभित्र यदि कुरा गरेर, बिकज लाइक आई सेड स्ट्रेस फ्याक्टर कहाँबाट आउँछ भने सोसाइटीबाटै आउँछ, हाम्रो फ्यामिली मेम्बर्स हाम्रो फ्रेन्ड ग्रुपबाटै आउँछ नि. कोहीले केही भन्यो चित्त दुख्यो होइन, झगडा पऱ्यो दिक्क लाग्यो, अनि त्यही कुरालाई हामी बढी सोध्छौँ, झन् स्ट्रेस गरेर बस्छौँ, अनि त्यसले के गर्यो, you are like burdening yourself with so much baggage, right? So त्यो कुरा त कन्भर्सेसनले त हेल्प गर्छ नि त. Communication, conversation, connections, these things help you. Now if you can do that, well and good. If you can't, go to a counselor. Somebody professional will guide you to think in a certain way. If that doesn't help, go to a therapist, and so on and so forth. So medication, it's surprising when you tell me this, because see, again, you're the youth.
Yeah.
Like I said, the youth are so open to coming to a counselor or going to therapy, and that kind of shows me the change that has happened, where the youth are very open to coming to a therapist and saying, okay, I need help, mero yo bhacha, like, so help me bhanera. And our job is to show them the direction to take so that they're able to find themselves, But I think some people are open to going to a doctor if need be, because they want to feel better. That is the reason why they come to you in the first place. Nobody comes to me without a problem, unfortunately, right? So everybody who walks in through my door is carrying a baggage of issues, and my job is to untie those knots. Help them resolve.
People have been open to taking medications.
Yeah,
if it's
I think
necessary.
If it's necessary, because we all want to feel good. At the end of the day, we all want to get up in the morning and say, oh my God, it's a new day. What can I do today? And at the end of the day, we want to go to bed and have a good night's sleep. Isn't that what we're looking for? No matter how much we study, no matter how much we work, how much money we earn, our basic needs are very simple. That we want to feel good every day. We want to be able to sleep. We don't want sleepless nights. We want to have a healthy life. And, we want to have family members who are doing okay, isn't it? So for that, I think people will go to help themselves if need be.
So, Agipani, we were talking about relationship issues. It is something that comes from an emotional baggage that you have from childhood, or it's something that you face in your relationship at current. So, when there's a breakup,
right,
or there's a dispute between the two partners, so how does that affect the mental health of a person? So,
right,
what are the type of experiences or the sort of trauma that a person goes through during the phase of breakup or a dispute?
See, again, we come back to stress. When there's a breakup, when there's a dispute, there is a stress factor. Now, I want to go back to something very basic, okay? Just recently, when we went through COVID and lockdown, there was a lot of mental health issues. We were all very frustrated. Now, why did that happen? That happened because we were told to stay indoors. We did not have the independence to do what we wanted. Now, what does that mean? That means we were not in control of our lives, right? We couldn't do what we wanted. Now, if you look at the kind of stress factors we have in our life, all of our stress factors happen because we feel like we are not in control. Now, it helps to understand what we are in control of, right? Now, each of us, you and me, we are in control of just ourselves.
Yeah.
How we think, what we say, and our actions. It's as simple as that. We cannot control the people around us, right? Be it in a relationship or in friendship or in a workplace or wherever. So, anywhere where you are connecting with somebody else, when you don't like something, or where you wish that this person said something different or did something different, all you can do is explain to them how you wish things were, right? You explain to them the facts, you give them the pros and cons. Now, does the other person take your advice or not is totally up to them. Can you control that?
No, we cannot.
Now, the problem arises when we have expectations from people, especially in a relationship. You expect your partner or the other person to understand what you're saying and do accordingly. And when the other person does not, that is when the stress starts. And that is when fights happen. Because you are basically saying, oh, मैले भन्दा भन्दै पनि गरेन. Don't you love me? You know, it's as simple as that, right? Now, what you need to understand is the other person has their own set of behaviors. They've had their own upbringing. They've had their own life experiences. So they will go by what they are carrying. I know. So people struggle when they feel like they cannot control the other person. Now, we need to understand that no, we are not even in control of our own children or our cousins or our siblings or our parents or grandparents. How will we have that control? Because everybody has a mind of their own. You know, everybody wants to lead us life a certain way. So we cannot have a hard and fast rule for anybody else. So when something like a breakup happens, right, you will be questioning yourself. A lot of times the guilt is there and the regret is there about why it happened. And so many times we do blame the other person, saying, "Ille garera bhao," right? But other times we blame ourselves unnecessarily. We take the blame and we say, oh, I wish I had done this. I wish I had done that. मैले यो गराबे हुन्थ्यो होला, मैले त्यो गराबे हुन्थ्यो होला.
Pachigo, the regret that makes you think, if I would have done something a little bit different, maybe I would be able to sustain the relationship.
Exactly. And guilt and regret is the darkest place to be in. Because like I told you, just like we can just control ourselves, remember the present, the 24 hours that we get in a day is our point of control. That is where we have control. We decide how we are going to get through the day. We decide what choices we are going to make, right? Now, the past that has already gone is not in our control. As much as we wish to change it, as much as we regret the things that didn't happen, we need to understand that there's nothing we can do about the past. Now, are you going to dwell on what went wrong and feel guilty and regret it and get stressed and start overthinking? Or are you going to learn from the mistakes that happened in the past and use that as a motivating factor where you're telling yourself, I'm going to make sure that never happens again because that was foolish of me, right? In the same way, we assume a lot about the future, right? We're always guessing. And हामी मान्छेको नराम्रो बानी के छ? राम्रो कुरा त हामी गेसै गर्दैनौँ. आजको एक हप्तामा झन् खत्तम हुन्छ होला. अहिले त झगडा पर्यो 6 महिनामा त हामी खत्तम हुन्छौँ होला.
Where is this going?
Exactly. And the assumption is always negative. Okay? So what we need to remember is future bana it's plain fiction. अहिलेको 1 घण्टामा के हुन्छ न तपाईलाई थाहा छ न मलाई थाहा छ. But if we were to guess, you know, we don't know what we would guess, right? So future ko assumption pani is something that we shouldn't be doing. We can work today to build our future. That's different. We set goals where we're saying, okay, आज म यति काम गर्छु so that I can reach my goal. That's a really positive way of looking at the future. But what we tend to do is we make assumptions. अब आज त यस्तो कुरा मिलेन, अब 1 वर्षमा त झन् के कुरा मिल्छ होला. Now you're already telling yourself it's not going to work. A relationship is not going to sustain itself. And then you might give your reference about somebody you've been with earlier and you say, oh, yo ta tyo jastai raheछ. Now again, that's not fair.
We tend to compare a lot
Of
of our
course.
relationships.
Comparison is high at this moment. Let me tell you that. And especially with social media, comparison is happening every second of the day, isn't it? I mean, do you realize how we take out our mobile phones at any free time and just scroll mindlessly? Most of the time, there's no reason to it, but we
Yeah.
are scrolling. And while we are doing that, we are comparing our lives with other people who've made those posts.
Yeah.
And then we are thinking, oh, हेर त यसले त यो गरेछ. I'm not able to do that. यो त यहाँ गएछ. I'm not able to do that. And what you're doing is you're putting yourself down all the time.
Yeah, even I do that a lot.
You do, right?
I look at my friends, I look at everything that they're doing, and मैले त्यतिसम्म गर्नै पाएको छैन. Maybe I'll be left behind, and maybe they'll go for
See,
me. So
now
this
what
happens
that
a lot.
does is it creates stress unnecessarily. And you might be carrying that stress and that thought with you through the day. And then you're overthinking. See? So everything comes back to
Yeah.
what you can control and what you cannot control. Right? And let me tell you that when somebody puts up a post, I mean, even you and I, when we put up a
Yeah.
post, it's not like we just put a random post.
We think we have a
think,
lot of
we
thought
plan.
behind it.
I mean, come on. When you change your profile picture, do you just take a random profile picture and post it? No. And it's worse when somebody else is taking your picture, right? Photographerले कति गाली हान्छ के खिचायो भनेर भने, you know, that is just the way it is. We are always trying to portray ourselves as a perfectionist. You know, we want everything to be perfect and it doesn't happen. And that's when we stress. So we need to accept ourselves for the journey that we have had. We are all a result of things that have happened from our childhood till now. So the acceptance that, yes, we've been through all that, and the appreciation of where we are. The fact that we went through it, but we are here today, is, I think, what is necessary for all of us to lead a life where we do not stress about things that we cannot control. And I think the youth are very open about it right now.
यो हाम्रो जुन habits छ नि of comparing,
Yeah.
like the ABC person has done this, I've not done that, or before I think my partner before him was better, or I think she was better than him.
Yeah.
So is this also one of the reason that anxiety issues have been so much developing early and increased to such an amount that every person you ask, they are suffering from anxiety. They don't know it's anxiety, but it is anxiety, हैन? So is it also because of our habit of comparison, to sense of comparison को कारणले गर्दाखेरि पनि, is it also creating a lot of mental disturbances?
Well, that too, but I also want to quickly address how easily people use terms like anxiety and depression these days. You know.
Depression, it's not even depression. There's a
Okay.
clinical depression मा जानको लागि there's a certain criteria in which if a person is going through a certain thing, it's
Yeah.
depression. But even if you're sad for 5 minutes, oh, I'm depressed. It's very
See,
easy to
that's
say.
what I'm trying to say. All thanks to Google, right?
Yeah.
People tend to put in whatever they're going through and then they come up with this thing that, oh, you know, I am depressed or I have anxiety about it. And that's where we're going wrong. You know, why are we trying to evaluate ourselves? Leave it to the professionals. You know, they've done years of studying and training to be where they are. That's their job. So our job is to keep it simple. So if you're feeling sad, it's an easier way to say it. Dikka lagyo, it's sadness. Why is dikka lagyo always depression?
Yeah.
Unless you've been evaluated, you know, then yes. So when you are stressed, you're just stressed. You're not anxious. It's not anxiety, you know. So yes, coming back to your question, this comparison is something that really builds a lot of stress factor. Why do we need to compare? When we compare, like you said, you know, if you're comparing your previous partner with the partner you have today, it's very unfair on the partner, right? You need to be open to the fact that each individual is different. The way you are and the way your partner is will be different because you come from very different backgrounds. You come from very different families. Maybe your educational background is different. Your experiences are different. So like I told you, it is very important to accept that that person is the way they are and to accept that you are who you are. and that's when we start appreciating people. When we start comparing people, what happens is the appreciation is gone, because we have put maybe our previous partners up on a pedestal and we're comparing our recent partners. How fair is that? So what we need to do is accept that every person that you meet is just the way they are. There's no judgment there. You cannot judge anybody, and then you appreciate who they are, because every person comes with, as much as we all come with a lot of baggage, but we also come with a lot of credibility, right? And that is important.
So when we're talking about breakups, and we're talking about how comparison is something that's going to not benefit us in the longer run. So what could be the coping mechanisms, what are some of the factors that we could utilize and generally in everyday life that is going to help us feel better in a certain extent after some breakup or dispute, not only just with the partner but with your parents, but with your grandparents, uncles, so whatever dynamics of the relationship might be, what could be the coping mechanisms that would really have helped?
I think the first and foremost important thing for each of us to do is to take care of ourselves, first of all. Because when we don't take care of ourselves, right, when we're just focused on stress, no matter how good the relationship is, we will never see it that way. Remember, when you are feeling good, right, everybody seems all right. Everything is doable. I know. When you're feeling sad, you just think everything's going down the drain. Nothing's working out for you. So we need to make sure that every day we're taking care of ourselves, which means we are thinking positive. We're feeling good about ourselves. I think that is really important, whether it's to cope with breakup or just to get on with our daily lives. You start your day, you have some sort of physical exercise, because that really helps throw off negative energy. That's a great way to start your day. When I talk about physical exercise, I'm not talking about going to the gym or Zumba, simple walk, watering your plants in the garden, just walking in your terrace, playing with your pets, playing with your children, whatever works for you. And it's really important to have a set routine. What time you're going to eat, what time do you get to class or to work, and how much you're eating, what you're eating, how much are you sleeping, what time do you go to bed, what time are you going to get up. Because what I see, especially in the youth, is very erratic routines. There is no routine. No, not at all. राति सुत्ने कहिले 9 बजे सुतेछ, कहिले 12 बजे सुतेछ, कहिले 6 बजे उठेछ, कहिले 10 बजे उठेछ. I mean, how is that going to work for you? So you need to have a set routine which gives you a discipline, which also gives you a sense of control.
So you are what you eat. Do you think our food habits are also one of the reasons that affects our mental health to some extent?
I mean, look, anytime we feel guilty, we feel horrible about ourselves. So the idea is to take care of ourselves so we don't have regrets. We feel good because of the way we lead our lives, right? How we sleep, what we eat, what we do, the kind of connections we make, all that is important. And I think that kind of helps us get through the day, get through breakups, get through any situation that creates conflict. The idea is to be in charge of your life. The idea is to be in charge of your well-being. Nobody else can do it for you. We expect people to tell us what to do. But the only person who knows what works for you is you. You know what works for you, and you know what doesn't work for you. So it's so important to pause. It's important to pause and ask yourself, okay, what am I doing wrong here? I'm getting really stressed. So what do I need to do about it? Am I sleeping well? If you're sleeping like 4 hours a day, obviously you're going to be cranky and irritable, right? So you need to start planning your day. You need to take care of yourself first, and that helps you every day.
This has been really productive. I myself had a lot of questions that I wanted to ask, and I think I got some clarity to some extent. So at the end of the podcast, is there any message that you actually want to give our audience, something that you want them to instill in themselves so that it's helpful for them in the future reference, whether they're suffering from something or they need something that they can take from this episode?
I think it's really important for everybody to understand that we need to first take care of ourselves, right? And we need to also understand that we cannot control anybody else. As much as we think that we're in control of everybody else, we're not. So the idea is to focus on ourselves, focus on our well-being, make sure we're doing the right things for ourselves. And that really helps us enhance our relationships with everybody around us.
Okay.
And it is also important to prioritize what is important for you and to let go of anything that is negative, be it relationships, be it conversations, be it anything else that you do which you know is affecting you in a negative way. So it's that just focusing on your well-being will help us filter out negativity. And that is something that we can all do, and we don't need anybody else to tell us how to do it.
So just cut off the negativity.
Cut off the negativity. You know what works for you. So filter out things that doesn't work for you. Focus on yourself. Take care of yourself. Sleep well. Keep that mobile phone away when you go to bed.
Yeah.
Stop scrolling mindlessly and stop comparing yourself with others, because I think each of us is unique in our own way. So why are we comparing ourselves with somebody else? I mean, come on, we deserve better,
Yeah,
right?
we do.
So yeah, that's our conclusion.
Thank you so much
Thank
for
you.
giving us your time today. It was really productive. And I hope that I get to talk to you in the future, and then we get to learn a lot of things from you. I look
Sure.
forward to meeting you again, and thank you so much.
Thank you for having me.
Thank you.